Mr. Reed is recognized for 5 minutes.
Thank you, Madam Chair. And as I was listening to some of the exchanges, I wanted to take a moment before I got into my prepared questions. And my colleague from Washington asked about the work requirements, Medicaid potential issues, and how that impacts substance abuse providers. And one of the things that it reminded me of is often Medicaid, and I know it's not the jurisdiction of this committee, but Medicaid's, I seem to get the impression's goal is providing insurance coverage is the only metric that a lot of folks here in D.C. Gauge its success by. By that I mean getting people into Medicaid programs, therefore they have health insurance, and therefore our job is done. But I think we can do better than that. And Ms. Brand, I think your response to that question illustrated CMS's point of view that we can go beyond just insurance coverage and actually getting to making people healthier. And so one of the questions I have for you when I want to understand the work requirements that are being proposed is if someone is in treatment for drug addiction, I look at drug addiction as a disease. It's a medical related situation. That individual to me is not an able-bodied individual, as those work requirements, as I've advocated for over the years, would envision. If someone is seriously addicted and in inpatient type treatment, is it CMS's position that that individual is able-bodied as we are trying to define it under the proposed work requirements that are being discussed across the country today?
Thank you for your question. I'm not sure I can specifically answer our definition of able-bodied because, again, the work requirements are outside of the realm of what I deal with day to day. But I can tell you, as I mentioned before, that our goal is to make sure that states have steps that they're taking to ensure access to appropriate treatment services, particularly for those who have substance use disorders or opioid disorders. So if there are people with addiction issues, our goal is to work with the states to ensure that they are providing access to those services and that they are giving appropriate
And if that
guidance.
addiction is a disease and that prevents them from being able-bodied, I would hope that our official policy position would be that that is not who we're addressing with a work requirement. The other issue that I would raise on this, that I'm so passionate about this issue, is that one of the things I hear from our employers across the country is that one of the barriers to reemployment, which is empowering to individuals, employment, a job, an opportunity, does a lot for not just their paychecks, but for their soul and their dignity and their mental health and their physical health, if you look at the reports that demonstrate that, is how does when you get somebody, and the barrier to employment is being addicted to drugs, not being able to pass a drug test. So we have a program under Medicaid or Medicare that is trying to address opioid addiction. Does that not help us to try to solve the overall issue when it comes to example for Medicaid in regards to getting people empowered to be put back into the workforce by getting their addiction under control and having the goal of not just insurance coverage for those individuals, but also the services and the treatments necessary to get them into a healthy position, which removes that barrier to reemployment that I'm discussing here today. Do you agree with that?
Well, as I mentioned, our number one goal is the beneficiary. Our goal is to make sure that we're getting the right treatment for the right people at the right time to help get them to be as able-bodied and productive as possible.
I appreciate that. And I share that commitment, and I hope our policies here at the federal level achieve that as we set them into potential future course.